As Congress struggles to repeal and replace the Affordable Care Act, some Catholics are choosing an alternative health care option. Joining us now is Chris Faddis, co-founder of Solidarity Health Share. Chris, what is a health share? How exactly does it work?
So a health share is essentially a cooperative where members choose to forego insurance and we choose to take care of our own health care needs. And by doing so, we pay a monthly contribution and then our dollars go to help other members with their health care.
So in that sense, is this an alternative to health insurance, or do you still need to have some form of health insurance?
No, this is an option that people can choose. My family, personally, we take care of our health care all with health care sharing. So we participate in that. All of our needs are met. Our child is on her way, and all of those are met by the members.
So I know Paul Ryan and some of the other folks have introduced an amendment providing high-risk pools to subsidize insurance covers for those who are seriously ill.
Right.
Is this kind of the same thing as a health share?
No, because it's still based on the third-party payer insurance model. So essentially what they're proposing is that the government's going to give private insurance companies $15 billion to help subsidize the cost of pre-existing conditions. And that's one of the biggest problems. The problem before Obamacare was the third-party payer system, during Obamacare and after. What we do is we go direct to, it's a consumer-driven healthcare system. So our members talk to their doctor, we work out the price with them, we help negotiate. There's no third parties in the middle, and we just facilitate the sharing. And that's the big difference. When you put pre-existing pools into the health insurance system, it's going to cost 70% more than just if we went direct to the doctors and the hospitals that we need to go to and get the care we needed.
You have a personal experience because your wife, Angela, died after a battle with cancer. How did that experience shape your view on healthcare?
You know, it was very difficult. Insurance was hard to deal with. We were left with the bag in a lot of ways. We saw that the healthcare system, they really wanted to help us. The doctors, the hospitals wanted to help us, but they couldn't give us everything we needed. At a certain point, we actually had to raise money to pay for treatment that would prolong her life. And online, we had 400 people raised the money and paid for her care, and that's what extended her life. She lived another 12 months past her prognosis at that point. And that's what really inspired the idea behind starting a Catholic health share, was this idea that, wow, this Christian community, this Catholic community joined with us, they prayed for us, they helped us, and we took care of each other's needs. And that was the inspiration behind starting Solidarity Health Share.
It seems like this healthcare idea is really starting to grow in the United States. Why do you think it's on the rise?
Well, I think we see now that the problem is this third-party payer system, and it's only going to continue getting worse. The prices continue to increase. The bill that Congress has proposed has proven that it's just going to increase even more. And people realize that if we go back to where we respect our choices with our doctor, we talk to our doctor, we work with our doctor, and we make those healthcare decisions, we pay directly to the physicians in the hospitals, take all the middleman stuff out of there that raises the cost, and then people get the healthcare they need, and we don't have all the waste and unnecessary spending that we have today. So people are recognizing that healthcare sharing has grown from about 200,000 families before the ACA to 1 million families nationwide doing healthcare sharing continuously, and their bills are being paid.
It is interesting to hear about the program. Chris Faddis, co-founder of the Solidarity Health Share. Thanks so much.
Thank you.